All right, hey guys, welcome back. And tonight, poor Mia, you're hurting. I'm Todd, Johnsonbaugh Your Chiropractor in Columbia, Maryland, with my daughter Mia here. And tonight, what's going on, Mia? Tell everybody about it.
My neck's like really stiff from
Eh.
sitting incorrectly and not stretching out enough.
Thank you. And the ergonomics, model that to everyone else that hasn't seen you.
Yeah, it's just like leaning over.
Yeah, and then your ergonomics, like you're at the computer,
Yeah.
you're a high school student. I also saw you today doing like this thing, like that too, like down like that, a ton. And obviously, Mia, where does everyone think she might feel it if she's going like this every day? All right, would you guess like in this area, right back here? Can you see my finger, Roman?
Yes.
You're right there. Would you say that's where it is?
Yeah, I think so, definitely.
All right,
It's kind
Mia,
of
go ahead, turn your back to everybody so everyone can see your
Yeah.
back. Because I want you all to see this. So let's do the exam. And I haven't really started off yet. So I just start here. And obviously if we were doing a full treatment for the full spine, we'd take a look at everything. But today we really want to give Maria some quick relief for this neck pain. So when I push the shoulder blade down here, not too bad. And it moves a little bit. When I'm over on this side, oh, right there. Oh, I'm sorry. And she's grimacing too. Let's do that one more time so people can see this though. You poor thing. You're like, Dad, you're doing this at my expense. So we're pushing there and it just doesn't move. Roman, are you able to focus in on that so people can see that?
Yeah, I am.
Cool. And then I'm here and it wiggles that you can see it just pushes down. It's not a problem. So one of the adjustments that doesn't happen a lot with chiropractic care is shoulder blade adjustment. So we'll be working with that. Next thing I'm doing is I'm moving the shoulder. And this shoulder actually wiggles in here. And you'll even feel it clicking. Then on this side, when I'm pushing in here, it's clicking. So that's actually not that bad, right? The shoulder blade so far. The shoulder joint itself, not bad. Now she writes a lot, so we'll check the arm and part of the kinetic chain. And I'm reaching around the front here. Mia, swing around. I know you poor thing, you're hurting, but I'm also, because when we type, we're on the phone a lot, we're on the computer, we're like this, we're folded in. So if I'm going to release this pressure here, I got to check the kinetic chain here, and also here. And that was cool, this was cool, but when I got down here, you felt, yeah. Was that, people could capture that emotion, right, Roman? Do I need to do that again so people can see that?
I mean,
No, not needed. Just like, what kind of dad? All right, next, let's go trace the muscle. So we got the joints of the extremity, what to work on. Next, we're gonna go, and we're checking this out. And this is the first rib, and this is the second rib. Mia, are you always surprised when we're up at the ribs, and people you're going, those are ribs up there? And you all can tell, maybe you can't, but interesting, this one's stuck here, but feel this one? Check this out. It's actually worse in this case. Excuse me, Mia.
Yeah.
That one's not too good. That's a muscle though, but the rib itself actually is still wiggling. So the muscle is off here. Feel that, how tight that is?
Oh, wow.
But the rib underneath here is not too bad. The muscle over here, not as bad, but this bone, feel how tight that is? Right there, feel how hard that is?
Yeah.
Roman, is she making a face when I do that picture?
Oh, yeah.
Oh,
Yeah,
okay,
yeah.
thanks. Sorry. You're like, you are. So anyways, very interesting. So we have to adjust the shoulder blade, the wrist, and this, and then finally, base of the skull.
Oh.
I'm sorry, sweetie.
No,
When I push at the base of the skull on this, that's the beast. And did you say you were having a headache too?
yeah, and backache too.
Okay, so we'll get that as well. So here, and then, so we're gonna have to adjust that, and we're gonna have to get the muscles. So let's start with the muscles, and then we'll get through this, okay? Now, I want everybody to see your range of motion first. So go ahead, turn your head this way. Good, as far as you can comfortably. Is that about as good? And does it pull a little bit on that side? Now go this way. Oh, that's pathetic. You can get there if you struggle, right?
If I
But you-
struggle, yeah.
Yes, okay. Good thing you're not trying to drive today. Go ahead now, side bend this way. Your head, just your head. Like that. That's pathetic for a 17-year-old. Now go this way. Oh. Oh my gosh. All right. I'm glad. I'm glad I'm home here. So, anyways, Mia was like, "Dad, can you help me with a thing?" And I thought it was going to be something like, what, have to write an email to like a teacher or something like that. But no, it's like, "Hey, please do this." And I was like, "No problem. Let's do this. Go ahead, lie on your stomach."
Okay.
So first, we're going to just open up the arms there and the shoulders. So I'm going to just take that wrist. Remember, we found that, and I'm just taking the wrist back here, and I'm going to open that up. And I'm pushing down here, and I'm just going to thrust just a little bit. Boom. Nice. Just real quick. Relax. Good. Perfect. A little bit of energy back there. Let's do one more. Beautiful. Nice, Mia. You are a pro at this.
Yeah.
Yeah.
I have a lot of practice.
You have a lot of practice. You do. Let's get this one. So right up here, real easy. Beautiful. You all see, it doesn't have to be really hard and aggressive. Sometimes it's quick, but not too bad. Mia, can you sit up again? We got to stretch out your neck before we try for those adjustments.
Okay.
So good job. So then we have to do the front of the neck. Excuse me, moving the hair, sweetie. But do me a favor and side bend your head. This way. Good. And you know what's funny, Mia? It's just after even just doing that little bit that we did, not even up here. I don't know if folks can tell this. You're already moving a little bit better, and we haven't even touched the shoulder blade yet.
Yeah.
That's so cool. Oh, yeah, that sucks. Oh. And see, when we move, we should be able to move fluidly. And what I'm picking up on is Mia's neck is actually moving like this. It's ratchety. Instead of moving smoothly, it's going come. She's in a lot of discomfort. So we're going to make sure also Mia remembers her stretches that she does. Throughout the day, Mia, what are the stretches I ask you to do a lot?
Stretch backwards over a ball, or like stand against the wall and you raise your arms.
And yep, so I ask her to do stretches that open up her chest and draw her shoulder blades down. And I also have her do exercises to strengthen her muscles that pull her shoulder blades down. Yeah, really important. Maybe we'll demonstrate those later on. All right. Next, turn your head. Now I'm holding that shoulder blade down. Turn your head if you can gently to the left. Good, and look down. Good, working a muscle called the levator scapula now. We finished up with the scalene muscle in the front of the neck and a little SCM work. Turn and go this way and look down. Good, and relax. We're getting there. Son of a gun. This is tough. Go ahead, give me that great posture. Bring the arm up. Now, when you bring your arm up, the shoulder blade is still not going down yet. So let's work on that. So I'm going to push it down as you bring your arm up. Ooh, what was that clunk?
I really want to know.
That had to feel good. Let's see if it wants to happen again. It's getting there. Getting better. One more time. Oh, good. I know you're battling it. Rome, are people able to see how she's trying to keep her shoulder blade down? Probably not. But yeah, she's
a little bit.
She's really trying to hold that shoulder blade down as we do this. Go ahead and turn your back to the audience real quick. I want to show them what we're doing. We're trying to get that shoulder blade to go down. So what I was doing is normal shoulder motion. When you move the shoulder blade should actually go down a little bit more. And her shoulder blade was not going down early enough. And still it's having a hard time. It's actually better. But what we're doing is we're just pulling that down. Go ahead. Keep your head forward, Mia. Good. And to try to draw your shoulder blade. Yes. So that your shoulder goes up. Let's try to restore that movement pattern. Again, you shrug your shoulders up towards your ears. Shoulder blades up. Draw them down. Keep drawing them down as I bring this over. Beautiful. Let's do that again. Go up, go down, keep it down as we go. All right, great. So we're starting to restore that abnormal movement pattern there. Good job. Now remember we did this. Turn your head to the Left again. Keep that shoulder blade down and look down. Good. Look down if you can, Mia, with your head. Good. And come on back. Still sore there. Still really sore. Let's go ahead and check that range of motion now. Turn back to the audience again, Mia. You're doing great. And this is how normal chiropractic care works. We go a little bit faster because we're not doing the explanations, right? But this is pretty much a typical day in the chiropractic office. And I'm glad you kind of had the chiropractic office at home here. So welcome into our office there. Roman, how many minutes in the filming are we? About 8 minutes right now?
10.5.
10.5? Oh my gosh, we gotta speed it up. Now, you guys get a full video today. You're gonna enjoy it. All right, and that's a typical, when you say when you are in the clinic with me, would you say a typical session lasts about 10 minutes or so? Depending on the case, 10 to 15?
Yeah, probably.
What would you think, guys? About around that,
Something like that.
average, give or take? Yeah, this is pretty average. But we just go through it faster because we're not, explaining everything. All right, Mia, now turn your head this way. Better. Turn your head the other way. Still stuck there. But we haven't
Better than
cracked
it was.
anything. It's a little bit better.
Yeah.
Give me a side bend.
To which way?
Either way. So you can go this side, I'm tapping. Good. And then go this way. All right, getting smoother. Now we got it. Let's do the adjustment. Go ahead, lie on your back.
Yeah, sure.
Good job. And Roman, I don't know if you want to get scanning close. First, we're going to do the one right here.
Should I not be laying there with a whole minute?
Nah, you're good. And then keep yourself nice and wrapped. Come on back. Roll back. Roll back. Good. This table is a massage table, so it's a little squishier. So we had to kind of lean in. You did good. You all right?
Yeah, I'm fine.
Now stay right there. Now I'm going to give the crowd a thumbs up. Like, I'm okay. You know what kind of reminds me of is that magic thing when somebody's getting ready to saw the young person in half and people go, I'm good. So I'm reaching underneath here, guys, and I'm actually working on her shoulder blade. Mia, can you lift your arm up a little bit so people can see that? Not your head, just your arm. Fold your arm across your chest.
Okay.
Right there. There you go. Cool, and I'm digging in. Can people see the hands over there,
Yep,
Ron?
yep.
And we're digging in, and we're trying to get that shoulder blade to loosen up. We're going to do this especially on the right side, but instead of having Mia move again, I wanted you all to see what that looks like. I'm loosen this up again and relax. So a lot of times people don't realize that, I love chiropractic. It makes a lot of good adjustments. Things move really well. But chiropractic with these other manual therapies just works wonderfully. And I just wanted to give you all a taste of what to expect. Now we're up to the neck adjustment. You got it. Mia's like, it's about time. But would you remember sometimes when we do the adjustment and, I make sure you stretch out, but we don't do the muscle work first?
Mm-hmm.
It usually doesn't go nearly as well.
Yeah.
Now we really also tried, Mia was a great patient. You probably noticed that what she was trying to do the entire time is hold the best of posture she could, even though she was sore. So she was trying to keep her shoulder blades down, and she was still trying to lift through the crown of the head there. And that activates key muscles. So she's been practicing this throughout the day. She'll be able to adjust easily. Some of my patients, when they first come in, they can't adjust very well because their bodies don't know how to position well. Holding good posture, practicing good posture, once you start to learn what it is an integral part of getting deeper adjustments. So we're going after the C1 adjustment. Remember, make sure a licensed chiropractor does this. Do not do this at home on your own. So I'm lining up right here. Rome, I don't know if you want to zoom in on this or not. I'm not going to move. And right there. Is it sore?
Yeah, a bit.
It is a bit sore.
Yeah, but
We'll make it happen. Yeah, you're doing great. Good. Ease that tension right there. Now, what I'm going to do to make this a little bit more comfortable, Mia, you can see Mia. She knows this stuff, but she's trying to relax. But what I'm going to do is I'm going to take my hand on this side, and I'm going to push right here a little bit in. Oh, it's a little sore there, but if I push right there on the other side, it's going to make this a little safer, a little easier. Oh, there it is. Right there. Relax right there. Boom. And it's done. You did great.
okay, great.
Wow. And there it goes. It's in place. Woo! You made it through. Now at the very end, I love to do some pressure point work. Some people call this craniosacral therapy. Very gentle and just work right through there. I know people are dying to see the range of motion. It will come back. Now Mia is going to continue to do her exercises throughout the day and we'll check in. Go ahead, come on up, Mia. Swing around. Good job. Let's go back and check all those sites. Wrist. All right, looks good. Shoulder blades. Looks good. Better. Oh, still a little stuck in there. So you're going to have to make sure you do that stretch. And that overnight will start to relax. But if we need more, we might need one more dosage of this. And then we go back and check up here. It's tight, but definitely looser. Mia, can you just show us the range of motion real quick? Go ahead, turn. Good. You don't have to look down, sweetie. Just go ahead and turn. Smoother. Great. Go ahead, give me a side bend of your head. Oh, yeah, and you can just do like that, and then side bend the other way. Good, 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 good. So Mia, you probably would you say that you're 100% better?
Not yet, but
No.
I'd say I'm definitely a lot better than I was.
Right, right. Typically, a lot of people haven't had a chiropractor as a dad. So what usually happens for you after the adjustment?
I try some of the stretches that you say.
So she does listen to me. We got this on tape. All right? And what else? And then what else do we expect? Like, when do you typically feel the most better? Like after this?
I probably feel the best the next morning.
Next
when
morning.
I wake up, yeah.
Yeah, when you wake up. So this just kind of helps slow things down. Sometimes we still have to heat, stretch, take some natural anti-inflammatories, things to relax the muscles, things like that. But you're on your way. All right, guys. Well, this was our first full video for Facebook and for YouTube. Welcome. We're excited about adding to the YouTube community and having some fun. Can't wait to see your comments for future videos to see. We have a lot of content there coming your way. So again, this is Todd Johnsonbaugh, your family chiropractor. Wishing you all just some great surfing out there on the internet. And hey, if you like this, don't forget to give us a thumbs up and subscribe to this channel. Love to hear your comments on what you'd like to see in future segments. Yeah. Remember, let's keep it positive. All right. Love you guys. Take care.